I was shocked that more than 50% of our patients wanted spirituality to be integrated into their care, yet a very minute percentage had ever had clinicians even inquire about this area, let alone actually, have a place to discuss it.
Can you give us, in your words, just a brief, succinct description of spirituality?
Yeah, as a clinical scientist, the way I define spirituality operationally is a person's perceived engagement with that which they see as sacred. If somebody sees an aspect of life as being sacred or separate from the physical world, having some sort of metaphysical, eternal meaning, which is not simply material, it's not simply worldly, it's something which is greater than physical, it's metaphysical, that would be spirituality, which is a broad definition, but I do think it encapsulates this aspect of the human experience, which unfortunately has largely been ignored in the fields.
Yeah, I mean, I recently came across a fascinating statistic that different cultures around the world have different perceptions of mental health and its various diagnoses. And their cultural sort of perceptions and belief dramatically impact some of the interventions and efficacy.
Sure.
And for example, I think in certain parts of Africa, schizophrenia is perceived to be, just the result of somebody being possessed by the spirits. And they perform certain rituals and rites to remove those spirits. And what was fascinating about it was that it seems that schizophrenia, which in America is not necessarily something that has a definitive cure, is curable, but over there they seem to have different types of results. Is that something that you've come across in your research and study? Does it somehow help us understand spirituality's ability to impact the efficacy?
I definitely don't know about that, what you're referring to, and I would definitely be skeptical that there would be cures for significant
Something
like
schizophrenia.
or schizophrenia,
Yeah.
which are coming out of spiritual traditions. But I do think that even when it comes to schizophrenia, the distress associated with it. For example, if somebody has psychotic thoughts, somebody has delusions, or they have perceptions of life which are not based in reality. They're having hallucinations, whether they're auditory or whether they're visual or another sense that's picking up on aspects of reality which aren't really couched in reality. They typically will judge themselves, get very upset about it, try to eradicate those thoughts, have a lot of associated distress and disturbance, which are not related to the thoughts themselves. They're really an artifact of their reaction to those thoughts. And I would say a more spiritual, if you will, approach is one of acceptance, that sometimes people's brains do certain things, and that doesn't mean it's the end of the world. It doesn't mean there's something that they need to deal with. They have to learn to cope with. They have to learn to function. And I think taking that approach is much more helpful and healthy than trying to necessarily eradicate this aspect of who a person is.
Is spirituality, in your view, a universal phenomenon?
So that's an empirical question. It's a scientific question. And the answer on that basis is yes. You find spirituality throughout all four corners of the globe. You find it across cultures. In some cultures more than others. But you certainly find people having some sort of sacred, separate, metaphysical way of thinking and practices as well.
And regardless of their belief system, whether they're an atheist, a nihilist, but that...
So not all human beings have spirituality. Not all human beings believe in something greater or have a sense of a more sacred mission and purpose, or view their relationships in a sacred way, or understand and respect that there are aspects of their lives which are potentially divine. But that doesn't mean it's not universal. It's certainly statistically the vast majority of the human race is involved in spirituality to some extent.
And when you describe it as being more intrinsic and latent within, the people who experience it, as more as something that is developed and cultivated as a result of the people around us?
So that would be a good question for my colleague Lisa Miller. She's really dealt with this question at length. Is it innate? Is it something which is cultivated over time? Probably the answer is both to some extent, but that really goes beyond my area of expertise.
And I guess my question to you as a doctor, as obviously somebody who is operationally involved in clinical interventions at a psychiatric hospital, as somebody who teaches, where does spirituality, would you say, where does it begin and where does it end in the therapeutic process?
Yes, that's really the primary question that I do deal with, is how can spirituality be integrated into therapy? What's the place for it? And the first question to me is, to what extent do patients want this? When I started quantifying that in Eastern Massachusetts, which is not exactly, the most religious enclave in the United States of America, I was shocked that more than 50% of our patients wanted spirituality to be integrated into their care, yet a very minute percentage had ever had clinicians even inquire about this area, let alone actually, have a place to discuss it. And many patients, and even people who are not psychiatric patients, but people who are in distress or they're just languishing, still want to think about things in spiritual terms. I think in some ways that speaks to an innate aspect of spirituality, although again, that's beyond my purview. But it certainly does behoove our field to cater to these spiritual needs on the parts of many individuals, especially those in distress.
Do you find that there are any diagnoses like trauma that almost make it impossible to fully recover without inviting the spiritual components of our psyche to the healing process?
That's a scientific question. Firstly, there's no specific diagnosis which is associated with greater interest in spiritual psychotherapy, except for current depression. Currently depressed patients are more likely to want spiritual psychotherapy. Everyone else seems to want it pretty much the same and to a high degree. In terms of recovery, I don't know of any data suggesting that folks with trauma are better or worse served by spiritual interventions. The one area that seems to be where it plays a critical role is in recovery. The statistical majority of people who recover in the United States from alcohol and substance abuse do so through 12-step programs, which I'm sure you know are predicated on a spiritual principle, and spiritual concepts. So that to me is the one area. But I don't know any data specifically suggesting that in other areas that certain disorders are better served by spiritual therapy than others.
I mean, even within substance abuse, I find very often that it really depends, and this is from the thousands of clients that we've treated, it really has to do a lot with the causation and pathway that led them to the chemical dependency. For some, it was an existential sort of spiritual deficiency, and that's where obviously a spiritual program like the AA 12 steps would be a prime intervention. But for others, it was, it was unresolved mental health, or
that could very well be.
And then for them, for example, medication-assisted treatment or other forms of psychiatric intervention are helpful. But definitely you sort of see that the 12 steps exploded in this domain.
Right.
Yeah, and that is clear.
Seems to have happened for a reason. So
right. And I guess as a follow-up question would be, where do you see the two worlds of religion and spirituality fusing in a harmonious, healthy integration, and where do you see them as separate, if there is any areas of separatism?
Between religion and spirituality in themselves. So that's that might be beyond my pay grade to answer that one. But with regards to religion, I see that as a subset of spirituality. Spirituality would be any way of relating to that which is perceived to be sacred, and religion are more cultural specific ways of relating to the sacred. Right. So I'm from a Jewish background, so I have a religious culture, and that's my way of relating to that which I perceive to be sacred. Other people from different religious cultures might relate to the metaphysical in a different way. Right.
And that's the key word that you're utilizing is metaphysical. It's not enough that it's larger than yourself, but that it's metaphysical. So for example, somebody has a connection to something much larger than themselves, but within our physical reality, whether it's a nationalist passion,
it could be
something bigger than ourselves.
I'll give you another example, is living a life with purpose and meaning.
Right.
I know many people who have a job and they don't necessarily see it as having relating to God, but they see it as having an aspect of purpose and meaning in their world and acting out and bringing their unique potential. And they will speak about it if you get them on, get them relaxed enough to chat about it. They'll talk about it as having some sort of greater purpose, which serves a non-physical end.
Yeah. I mean, I don't know if this is something that you've researched, in the work that you do professionally, but there's this incredible wave of psychedelic interventions that is sweeping the country. Sure. And it's, whether it's MDMA in the phase 3 trials, clinical trials with MAPS, or whether it's the ayahuasca movement that is currently, not something that is practiced in behavioral health care. What's your take on it? I mean, the MDMA, for example, seems to me like it could potentially change the world of therapy because it's done within the therapeutic process. I mean, for those who are not familiar with MDMA, it's a synthetic, sort of composite that, from what I understand, reduces the amygdala, the fear and the anxiety, and allows a patient and a client to open up in the therapeutic process. Do you have any specific thoughts on that?
Just to, I think, explain your question a little bit better, often individuals who take these psychedelic substances, hallucinogens, therapeutically or recreationally, will experience some sort of new, greater openness to the spiritual world. Yeah. And the question is, does the advent of these new, let's call them even medications, or these new interventions is probably a better word, and their study, will that open up the field to greater spirituality, and could it be a new wave? There's certainly a lot of experimentation being done within the academic medical world, in psychiatry on this. I think the jury is out. It's very early days, and I don't know. I don't know what it's going to bring. I do know that it's made people more open to the idea that spirituality could be more intrinsically linked to specifically things like depression, which we've seen in the data for a long time, but people have kind of ignored it and not really paid attention to it. So that's been, in some ways, a good thing, but it's still really early. Who knows where this is going to go?
Right. It's definitely sparking a very lively discussion about,
which is healthy.
Yeah, about the parameters of these interventions. Would you say that there are any specific sort of principles and cultural values that you've inherited from your Jewish tradition that help inform the way you treat a client, or the way you would define spirituality as an effective method of helping folks with depression and suicidality?
Sure, I think there are a couple. One of them is, in my Jewish upbringing, I was really taught over and over again about the importance of our relationships with others, and also our relationship with God, our spiritual relationships. I think the words are ben adam l'chavero and ben adam l'makom, our relationships with others and relationships with God. And many of the practices that we have in Judaism are intended to create greater connection with other people through giving, being generous, trying to change the world, trying to impact people's lives in a positive way, whether it's charity, whether it's loving kindness, whether it's having people over, hosting guests. All of these, not only principles, but practices, I think they speak to a larger importance of having a connection with other people as a foundation for our thriving and flourishing in this world. And the data bears that out in a big way, that the degree to which our connections are robust, within our families especially, but also with other people, that can insulate and protect us against depression and anxiety and substance abuse and all sorts of other disorders. And furthermore, integrating family dynamics, and whether it's marriage therapy or family therapy, into treatment for certain disorders like eating disorders, that's something which is in many cases necessary for the treatment of the patient. So that, I think, is a distillation of this general principle that I learned
That's beautiful. What I love about what you're saying is because it really helps so many people walk away, even from this conversation we're having, with insight as far as what preventative measures we can take to make sure. I mean, I'll give you an example. It's, when it comes to trauma, so two people can go through an identical experience. One will be traumatized and one won't be traumatized.
Correct.
And that's largely a result of what the state of their nervous system was prior to the traumatic event. One was healthy and one was sort of susceptible, and one was, fragile on their nervous system. And you couldn't really see that before the traumatic event, but that sort of exposed what was really lurking underneath. But taking these sort of wellness and the social support and the connectivity between, family and having an identity rooted in something larger than ourselves and the metaphysical really primes us to be able to weather the curveballs of life and to just really exhibit a certain resiliency that is incredibly helpful. I mean, society is obsessed with preventative measures when it comes to medical health, right? We're in the gym, we're doing yoga, we're watching what we eat, but somehow with mental health, the whole dialogue and discussion of preventative is not really there in as strong a measure.
Correct. In those relationships, people, having a shoulder to cry on, is really critical.
That's right. One of the most beautiful, statements in Pirkei Avot, book, Ethics of Our Father, Kanei lecha chaver, acquire a friend for yourself.
Yes.
I always found that it was interesting, acquire, who wants to buy friends?
Right.
I haven't seen this anywhere, but I think it's like an acquisition. Anytime that there's a transaction like that, each party gains. That's what makes it an acquisition versus a gift. And I think with a friendship, each side is really mutually benefiting on that type. I mean, does the data show that those who have those very healthy, supportive family relationships are less prone to depression?
By leaps and bounds. I'll tell you something. A couple of years ago, I gave a talk at Harvard College, and the director of the counseling center was there, and he said that in his data, there was one statistic that really stood out in terms of identifying students who would end up requiring significant support, emotional support, and behavioral support, and having psychiatric disorders during college, and those who did not. Take a guess which one factor it was.
Parenting?
Nope. Not genetics, not parenting, not socioeconomic status, not the courses that they were taking or their major, not which dorm they were living in or how far away they were from their parents, not their travel schedule, not the time of season or the time of year. It was, do you have at least one person in your personal life who you can go to for help when you need it?
Wow.
Shoulder to cry on.
That's so powerful.
Human beings need it. I'll tell you why. I think what's really going on there is not only do we need a friend, but we need to show that we can be vulnerable with someone. We need to be able to show at some points, I don't have it together. And that's okay. I can still accept who I am, even if it's just for a moment. And the rest of the time, we're polished, we're professional, we're on Instagram, we're rocking it, right? We're doing everything. But at the end of the day, everybody has something that they struggle with. Can we be real about that and show at least one other person our vulnerability in that moment? If we can, it's a huge insulation.
Yeah. I mean, talking about, the relationship that Judaism has, and Judaism, some of the spiritual, cultural precepts and how it impacts mental health, I saw a really beautiful correlation between our mourning process and some of the conventional, clinically appropriate ways to mourn. And one of them was the kriya, that somebody has a loved one who passes away, they rip the clothing. Yes. And one of the ideas behind ripping clothing is because we tend to go into denial when we're faced and confronted with something so overwhelmingly painful. And unless we confront it and we process it and we, engage with it, even though it's painful, we'll never ultimately be able to release it and find acceptance and move on. That's one of the things about EMDR, right? It's just sort of, there's this image of a traumatic episode that gets frozen, and EMDR helps us put it in the archive section of our brain in the past. So it's almost like, if we're not going to open up about our vulnerabilities, our weaknesses, our challenges, the non-pretty parts of ourselves to someone, it's going to be lurking and stuck somewhere. Correct. It's going to leave chaos.
That self-judgment is what perpetuates and exacerbates the distress over time.
And would you say that today more than ever we're dealing with this delusional sort of notion that we have to be on display 24/7?
Yeah, I'm not even sure it's delusional. I think many people do have to be on display, or they feel that way, and we are scrutinized more than ever. through social media, through a variety of factors. And also we're displayed with images of perfection day in and day out, and that's not reality. So I do think that the more we can accept that, humbly accept that we need help and be okay with that, relating that to others, and that to me is also a spiritual principle.
Right.
Human beings are not perfect, and we're here on this earth with very limited control and very limited knowledge and very limited scope of influence. Yes, we can make choices. Yes, we can dream, and yes, we can pursue those dreams. At the end of the day, though, we're actually quite vulnerable as a species and as individuals. And I think recognizing that has a spiritual overtone to it in some ways, that maybe there's something else which is running the show or above us or something.
You see this thread throughout the Bible. Almost every one of the great heroes had their mistakes, and we chronicle and we document their errors and their failures. And talking about a friend, it always struck me that there was such a beautiful relationship that Yehuda had with his business partner, the Canaanite man, and they seemed to be so close. And when Judah had his problem, and he had an immoral transgression, it was his partner that he turned to help him, to turn to him, please help me fix it. He clearly had a very strong relationship. And the funny thing is that it was outside of his family, which makes so much sense, because sometimes the people who we're really just, allow ourselves to be vulnerable and open to are people we don't want to feel shamed by. And sometimes that might be somebody outside of your community or your family.
Right.
In conclusion, what words of advice and counsel would you give to somebody struggling with mental health, with depression, or if a principal was looking for some helpful tips to implement into their school, into their curriculum? What can we do as a society to change the trend?
It's hard to give advice to everyone, but I will tell you this: I think people have to know where they stand. Broadly speaking, I think everyone stands in essentially one of four camps. We're flourishing. We could be flourishing and doing extremely well. Living life, having good connections with others, or self-care is in a good place. So that's category one. We could be languishing, which means that we're not necessarily clinically depressed or anxious or struggling with a substance disorder or something like that, but we're not flourishing. We're somewhere in the middle. That today is a huge number of people, by the way, who are languishing. The third group are people who are distressed. They have clinical depression, they have an anxiety disorder, they have significant distress or impairment because of their symptoms. And the fourth people are people who are severely distressed, and they need either a residential facility such as the ones you have, or a hospital like McLean where I work. They might need more intensive care. And I think, you said, what's something we can do? It depends on where you're holding. For people who are flourishing, they still need support, whether it's speaking to a religious mentor or, going to a JLI program or, something to help them, trying to make our relationships more robust. People who are languishing need that even more, but they also might need more specific support, whether it's a self-help book or maybe even once or twice meeting with a therapist. People who are distressed and severely distressed, they need professional intervention at a different level. And I think we need to know ourselves and where we're holding and make sure that we get the support we need.